everyone. Today I presenting our project title MedGraphRAG towards safe medical large language model via graph retrieval augmented generation. This was carried out under the guidance of Dr. Shivakrishna, Associate Professor in the Department of Artificial Intelligence and Machine Learning. Our team includes me, Sai Kumar, Gayatri, Avanish, and Ankita. Our project MedGraphRAG is a graph-based retrieval augmented generation framework. It is specially designed for the medical domain, where handling sensitive data accurately and safety is critical. Our goal is to improve the performance of large language model by ensuring the answers are not only accurate but also evidence based and explainable. Here the introduction of our project. MedGraph RAG focus on medical question answering. We use large language models, but we go one step further by organizing the medical documents in a graph structure. These help us retrieve the right information more efficiently and answer the question based on real data, not assumptions. It also boosts safety when working with the private health information. We have done literature survey by going through patents and many papers which actually tells about the how the RAG model works and how the data is retrieved from the documents. We, stu- we studied several existing systems such as GPT models by Power AI and Gemini, BioBert and ClinicalBert. The, these models are useful but come with their own limitations. The challenges includes the limited content handling and hallucinated or made up responses and poor support for evidence-based answers. Also, their document processing methods are too rigid and lack deeper knowledge connections. Here is our proposed system. Our proposed system solution MedGraphRAG solves the problems by combining document chunking and hierarchical graph structure. This is not only improve information in organized but also allows better categorizing the categorizing and understanding the relationship between the medical concepts. Our main objectives are to build a medical question answering system better than the current models, provide credible source linked answers, and handle diverse medical data sets, offer detailed explanation for the medical terms in answers. And here the architecture of our project, and it starts when a question that is passed through the retrievers like BM25 and converters and specters and medcpt, which search through the medical corpora such as PubMed and textbooks. The retrieval data is indexed and processed by the LLMs like GPT-4 or generates an accurate evidence-based answers. These setup combines the retrieval and generates ensure reliable and medical responses. When it comes to the workflow of medical graph RAG, it starts when user give input like questions and then it undergoes document checking, entity extraction, hierarchy graph construction, generative evidence based response, query processing and information and updating the model by the user feedback given. We use several algorithms like FASIS for the fast similar search and HNSW for the approximate nearest neighbor search and embedding models such as medcpts and converter specters. We also use BM25 for the pair retrieval and spectral rank function to combine the multiple retrieval outputs. Here our use case diagram shows how the user interacts with the system to input a question and receive the evidence-based medical answers. The result shows significant improvement in the retrieval relevant factual medical information and reducing the hallucination when compared to the traditional models. Here it only gives medical domain answers only. And to conclude, medical graph represents a meaningful step towards the safer and more reliable use of AI in healthcare. It leverages the power of large language models while grounding them in a structured medical data. Ref- References. Here are some key datasets and papers that supports our projects like Med, PubMed QA and MCQA, which are crucial for training and evaluating our models.